Since pregnancy is full of the unknowns, it takes the guesswork out of this area by monitoring health progress and screening. 4D ultrasounds are only performed when medically necessary and is currently the more sought out modality for younger patients and in pregnant women, owing to the absence of tissue damaging radiation rays that are normally found with such modalities as MRI and CT imaging. It is completely safe and painless not only due to having no radiation exposure, but it does not require anesthesia or sedation in most cases.
4D imaging has numerous benefits that have contributed significantly to society. 4D ultrasound is a painless and non-invasive procedure that enables doctors to obtain high-quality and detailed images of moving fetuses, know the baby's gender and development, more accurately identify any anomalies, especially of the heart, limbs, face, skeleton, and neural tube, determine fetal brain impairment by assessing behavioral patterns, decrease psychiatric and surgical morbidity during the first trimester of pregnancy. This is by allowing the option of any early versus late termination of pregnancy, which minimizes the risk of miscarriage from an invasive procedure later on in a pregnancy. Detect chromosomal defects, for example Down syndrome, by measuring the amount of fluid behind the fetus's neck. 4D ultrasound poses some disadvantages that expecting parents have to take into consideration, such as cost. It's relatively a costly procedure as it utilizes expensive machinery, requires professionals to perform the procedure, so longer training is needed to operate the machinery. Low quality images. Fetal movements will affect all planes of viewing. Visual obstruction. The shadows may hinder the view if the fetal spine isn't at the bottom of the scanned field. Ethical issues such as sex-specific abortion in developing countries such as India and China.
Although there are many beneficial clinical applications of 4D ultrasound, the strength in delivering high-quality images can still remain relatively low and would not be able to support current issues like visual obstruction, artifacts from sound wave, and uncontrollable internal body movements. Nonetheless, it is an exceptional modality and could otherwise be enhanced with modern tools and knowledge, potentially reducing cost and professional training.